The most common side effect for chemotherapy is fatigue. Fatigue can range from just being tired for 1 to 2 days after chemotherapy to feeling tired for up to 1 to 2 weeks or even 3 weeks. The important thing with fatigue is to listen to your body. If you're tired, rest. And if you're not tired, it's fine to go out, even to do gentle exercise during chemotherapy. Nausea can range from very mild nausea, whereby you might just have a little bit of change in the taste. You don't really feel like eating, so it could be very mild, or it could be something a bit more severe to where you're almost vomiting a few times a day. These days, vomiting and nausea is well controlled. There's always medications that we can give or treatments that we can offer to make you feel more comfortable. Now, not all chemotherapy drugs cause hair loss, so often your doctor will explain to you whether your drug that you're going to be experiencing will or will not cause any hair loss. Your hair may fall out during chemotherapy, but we can be quite confident that it will grow back once your chemotherapy is over. Well, the key also to hair loss is there are supportive measures to make sure you still look good even when your hair is falling out. Things like scarves, wigs, and so do talk to your doctor or to your nurses about it. The degree of mouth ulcers can vary depending on the drug. Some people say they just experience pain or very gentle tingling in the mouth. So often we would advise patients about how to prevent mouth ulcers, and that sometimes may come in the form of mouthwashes that we would offer to the patients to gargle 3 to 4 times a day, and that's often been shown to help prevent mouth ulcers when you're going through chemotherapy. Also, we'll give you advice on dental hygiene. This would often include brushing with a soft toothbrush, and all these little measures do help to prevent ulcers. Most people say that there is a mild change in their taste buds, so sweet foods may not taste as sweet, salty foods may not taste as salty. So once again, it's a temporary side effect. Usually once your chemotherapy is over, your taste buds will go back to normal. Your immune system may be lowered. So when your immunity falls, you are at a higher risk of getting infections. So once you start chemotherapy, our advice to you is to always watch for fevers. Now, if you do get a fever above 38 degrees, you have to let your doctor or your nurse know. And if it's after hours, we often advise you that you'll have to come straight into the emergency department if you have a fever, and often they will contact your doctor and we will take care of you from there. You may not get all these side effects, but you might get some of them. So once again, the type of side effects that you may experience depends on the type of drugs that you are experiencing. Everybody tolerates chemotherapy a little bit differently. So some people may experience no side effects at all during chemotherapy. And some patients unfortunately experience many side effects. So most important of all, don't be worried or embarrassed about side effects. Do let your doctors know whatever side effect you may be going through. We're here to help you. And we will be seeing you regularly during your chemotherapy. So if there's anything unusual that you're not feeling well about or you're concerned about, do bring it up to us at any time.